Thank you very much, Itachiro. We're going to start with the first roundtable that I anticipated beforehand, and I'm very pleased to see that there's about 700 people connected to signify the importance of this day together. So I would like to call, if I can put my glasses on, because that's the age, Maria Paola Chiesi, who is Director of Shared Value and Sustainability of the Chiesi Group. Good morning, I can see you connected, and also Gianfelice Rocca, President of the group Techint and the Humanitas group. Good morning, Dr. Rocca. I can see you connected. I can see you with my glasses. When I take my glasses off, I can't see anymore, but this is part of visible sustainability. Anyways, from this point of view, I would like to understand with Dr. Chiesi the teachings. Let's talk about the vaccine part, which is, of course, at the forefront of the news and its cause of concern at the moment. But apart from the vaccine virologic issue, the teachings that you have taken from this horrible pandemic so far, the floor is yours. We cannot hear the audio. You have to activate your microphone because it's better if we can actually hear you. No, we can't hear you? Yes, now we can. Perfect. Face and voice. Thank you. Good morning. Well, certainly we could write volumes, and there will be volumes written on the teachings that we have taken from COVID-19. Let's say that I would like to talk about a couple of aspects. Firstly, we've seen how the pandemic has really put to test the resilience and resistance of the healthcare system, not only in Europe, but in the rest of the world in an unprecedented way, and reminded all of us something that we take for granted, which is health is fundamental, not only for the well-being of the individuals, but also for the well-being of our society. So as we are still fighting COVID-19, we have to start a collective reflection on what this crisis has taught us relatively to the state of the sanitary systems in Europe, and to what can be done better, to what can be done differently, but also on the role that we wish for health to have as a strategic factor for social sustainability, not only of a country, but of a whole continent. So, unfortunately, the pandemic has highlighted how the lack of preventive investment in resilience and capacity of service of the healthcare system has had an impact, as it saves money in the short term, but can have devastating effects on the society and on the economy, as we are seeing in the long term. So once for all, we should stop considering healthcare expenses as a cost, but consider it as a strategic investment for social sustainability. So the road towards a resilient and sustainable health system has to forcibly go through a systemic, long-term approach that goes from allotting more care, more efficient care, investing in preventive medicine, and of course in training an adequate number of healthcare operators that are competent and that are coordinated. So we also must find a balance, an economic balance in this system, so a balance between the necessity to incentivate research of future treatment on the one hand and guarantee therapy that is accessible economically to healthcare system. Now, a systemic approach to health means investing and strengthening the European industry of sciences to strengthen our capacity as Europe of innovation, but also in order not to depend from other nations for treatments that are innovative or not innovative. And the example of vaccines is there for everyone to see. It's emblematic and quite tragic, I would say. So it's not about protectionism here, but it's about investing in a strategic sector for innovation, progress, and well-being of our society. At the same time, we must not lose sight of the global perspective. The third objective for sustainable development is good health for everyone at every age. This engages UN member states to try and reach by 2030 a global healthcare coverage. What does this mean? It means that everyone can be ensured the complete spectrum of essential healthcare services, from promoting health to prevention to treatment and rehabilitation to palliative care when they are needed. So the whole life cycle of an individual. Now, we are very far from this objective because according to WHO, and these are data from the 1st of April, half of the global population still does not have access to a full coverage of essential healthcare services. And the pandemic just widened the gap, just like Professor Monti was saying, between rich and poor countries and between different types of population within the same country. So reaching this objective has to go along with two aspects: training and healthcare operators are competent in all the different territories that are adequately remunerated, and also involving governments and collaborating, solidarity between states and public-private partnerships. This is the only way to tackle the most important environmental and social challenges of our time, which are climate change and social crisis that entails mass migration. Thank you. And I go back to you when we're going to talk about the pharmaceutical agenda, which is a very pragmatic concept. I would now like to give the floor to President Rocca to understand something that is apparently but it's apparent but not obvious. We've been talking about the acceleration of research in the pharmaceutical field. Of course, I'm talking about vaccines and all of the research on vaccines. There have been some doubts and misunderstanding, and it's undeniable there has been an acceleration that has never been seen before in global investment in terms of pharmaceuticals. So my question is, do you think that there has been an acceleration or an investment in terms of sustainability? I mean, I realize that at this time, the most important topic is to have health safety for the population. But I would like to understand if you noticed an acceleration or at least an increase in the speed of investment in sustainability from the healthcare point of view.
Well, certainly COVID has changed something that may remain also in the future. It may become a permanent element. In the beginning, I was in Bergamo. I visited the hospitals there, and I saw the tragedy there. And the tragedy spread all over the world quite quickly. But it was the first country that experienced such a bad event. There was an unprecedented exchange of information worldwide. We organized webinars on ICUs. We were the first over there, and we had dozens of thousands of participants, and we were all trying to find the best treatment. At that time, it was dramatic, and there were no solutions as we have today. Although there are still no final solutions despite the evolution of research, the great innovation at that time was that all data were made available quickly worldwide on the genetics of the virus and on the gene sequencing. So the technologies that were there already, they were ready to be implemented, especially mRNA technologies, were actually exploited, and it could be done because a paradigm shift in research took place. The relationship between government, academic world, and regulators has changed, and the parameters have been shifted. So governments could actually start new cooperations. Think of the Oxford cooperation with the industry, AstraZeneca, and regulators. This cooperation enabled a change that would have taken years in the past, and so that redesigned the relationship between risk and safety. In the past, that drove up the cost of pharmaceutical products because of the so-called thalidomide effect, where you wanted to eliminate every possible mistake, thereby not considering the risk-benefit ratio. However, this requires the ability to establish a dialogue with the population, because you need to explain the relationship between these two factors, risk and benefits, which are both very important. That's as far as vaccines are concerned. The impact that this had was devastating on the healthcare systems. I mean, hospitals were on the front line, working like crazy. We saw in Italy an extraordinary human capital, an extraordinary ability of people to work and change their competencies. In a couple of weeks, there were orthopedic surgeons doing the job of infectious diseases experts or internal medicine doctors. So the entire system adapted quickly. We saw progressive adaptation of the worldwide supply chain system. That was really impressive. I mean, today, in terms of protections and characteristics, in a few months, the global system has readjusted. We've seen small companies coming to the forefront when they would normally disappear because of large companies taking over. This also meant big mistakes in terms of the inability to tackle the structural problems of the healthcare system that are due to a general governance system. There were clear signals before, namely the sustainability of the life sciences systems. We have to consider the average health of population when the population is basically healthy, and you have to support this system in a sustainable manner. The life expectancy is 65 years in 4 different countries, UK, United States, Germany, and Italy. In the last 10 years, the average age of the male population has not increased, whereas it had grown consistently in the past 10 years. This says a lot in terms of the direction of research and the way care is delivered to people, and the participation of private parties and the efficiency with which we can do all this. This speaks a lot in terms of governance systems and attraction of investments. So we have to tackle this big issue. We have resilience, a problem in terms of resilience, which has been tackled with all the crises of the great nodes. In my opinion, the next pandemic could be the pandemic of cybernetic systems, cybernetic systems. So we could have a crisis affecting data and telecommunication systems, cybersecurity pandemics. In my opinion, that will be the next pandemics, which will follow the same path as regular pandemics. We are totally unprepared to face these issues. So I welcome the attempt at establishing governance authorities that can tackle these risks in a short period of time, affecting capitals, goods, exchange. So the level of exchange on the networks exposes us to big risk. And then facing the topic of replacement of life sciences as a holistic system within a framework of social, economic, and philosophical sustainability is key, because it's clear that if citizens expect immortality to be guaranteed by the state without having any duty in addition to rights, the duty to take care of yourself, the duty of prevention. I mean, if we pursue a model of life that wastes health, and on the other hand, it claims and wants all possible care interventions, so we generate a society where health becomes impossible and triggers big social frictions and political frictions on which you win or lose elections worldwide. So within the life science group of Confindustria that I chair, we are trying to face this topic. We have involved major entrepreneurs, but together we have to think about social sustainability, economic sustainability, and contribution to value creation that we deliver to the system. Thank you very much, Mr. President. I'll go back to you later on another topic. You hinted at the acceleration also in terms of immediate response capability and the response in terms of sharing data on a global level. But you also focused, if I understood you correctly, on the difficulty in making our responses long-term or structural. One thing is the immediate response, and another thing is to embrace it long-term. As Mr. Monti said before, there's a need for a sort of rebalancing mechanism. Mr. Monti mentioned the Financial Stability Board on the financial level. We may think of a similar mechanism for health. It's too big a topic to be left to individual states. As what was lacking was an international coordination on a global level, which we do have in place on monetary policies and monetary flows. I'm not saying it's a perfect coordination system, but at least there is a place, a venue where people gather and exchange ideas. I'd like to go back to you, Mrs. Chiesi, on another topic, i.e. the pharmaceutical agenda. This is the way it's known by common people. What is it, and what would be the target for all the companies involved? Well, the European Union issued a strategy on the pharmaceutical industry. It was last fall. And this gives an indication that the pharmaceutical industry is considered to be strategic for Europe. It's a strategic industry because it's a source of innovation, and as we have seen, health is at the basis, at the core of society well-being, including economic well-being. So this agenda has to consider two basic aspects. First is innovation, which is a part of the DNA of the pharmaceutical industry, protecting the health of patients on the one hand, and then social environmental sustainability on the other hand. On the issue of innovation, something is changing here too, because typically, let me say this first, the pharmaceutical industry is growing strongly, and it was growing even before COVID. As Mr. Rocca was saying before, the demand for health is increasing, both because of the demographic increase, the population increase in some countries, and because of population aging in other countries. But most of all, because of a demand for increasingly higher lifestyles, level of wealth, a level of wealth that is increasingly higher. Now, this growth necessarily raises a question on the adoption of ethical practices in terms of the relationship with patients. So the issue of innovation should be reviewed in light of the relationship with patients. Typically, the pharmaceutical company would deal with molecules and mechanisms of action, whereas we need to rethink what we do and how we do it. And we have to rethink of our patients as human beings and not simply as a set of physiological functions. So we, as a company, but also as an industry as a whole, we are trying to find new ways allowing the entire R&D process to be guided by physical, psychological, and practical needs of the patients. Taking the view of the patients, trying to understand their requirements and needs, and collecting their feedback. So as to provide effective therapeutic solutions targeted to their needs. That means innovation on the pharmaceutical front. However, a focus on the patient is necessarily connected with a necessary focus on the environment. Unfortunately, I'm not as optimistic as President Bonomi in terms of our actual ability to combat climate change and on the actual awareness of the climate crisis that we are faced with. Now, the focus of the pharmaceutical industry on the environmental impact should be full-fledged, both in terms of the origination of new pharmaceutical products, but also after the drugs or pharmaceutical products have been used by patients and is released back into nature. Fortunately, the pharma industry is very aware of these aspects, and it's also strongly regulated in this regard. We are working on a future-proof R&D system, a system that integrates sustainability since the design phase, the design of new therapies, taking a life cycle perspective. We are also committed to reaching carbon neutrality by 2035, therefore reducing our emissions of our carbon dioxide emissions and then intervening systematically on the reduction of all the other emissions into the air. However, a fundamental aspect for us was to review the carbon footprint of each and every product that we manufacture, especially sprays for asthma and chronic bronchitis patients, which at the moment contain a propellant, which is an important greenhouse gas. So the company came to the solution to replace this propellant with another one that has a smaller environmental footprint, investing 350 million euro to do that. So we made a big effort in terms of redesigning products. So the target is 2025, by which we will offer a low carbon print propellant for asthma patients. So patients should not accept compromises in terms of choosing between their health or environmental protection. The two things need to go together. This is fundamental for the agenda established for the pharmaceutical industry, protecting health and at the same time protecting the environment. And at the same time, as Mr. Rocca said before, we need to protect economic sustainability of healthcare systems. This is what we call social responsibility. Now, President Rocca, you were mentioned by your colleague, so over to you to close this first roundtable. You already referred to the points that worked out well and other elements more on the medium-long term that need to be tweaked and better twisted, so to speak. Now, it's easy to refer to the vaccination campaign as the biggest challenge, but what is the biggest challenge in general, in your opinion?
Well, the biggest challenge that is waiting for us is the reconstruction, going back with COVID and realizing that the problem of the healthcare system and of Europe based on welfare, where health is an important element, a Europe that is between China and United States is still something to build. And in order to build this, we need a governance mechanism and a strategic thinking mechanism, which is one of the most sophisticated things that there is at the moment. And it is the responsibility of global European and Italian politics. Today, the interest is focused on well-being much more than agriculture or industry or other fields of human activity. But this requires putting together competencies, economic and sustainability competencies and scientific competencies in a very innovative way. Otherwise, we shall have a system which is also the system that uses and produces the 50% of data of the world, genetics, biogenetics, epigenetics, metabolism. We are producing an infinite quantity of data, and through AI, we can study everything by correlating this and putting it at the disposal of care and prevention for the very first time in human history. So being able to do this by governing this in a sustainable way without the risk of a state reaction like COVID, so that all this is in charge of the state in terms of expenditure, in terms of mechanisms of delivery of all this to people. I believe that in the large hospitals today, we need education, we need doctors that can manage all these new technologies, but still preserve the human dimension, of course, empathy, and more minutes dedicated to the relationship with the patient are very important. The United States are down to 7 minutes, and the preparation is 12 minutes. So this is very important. This has to change in the interest of mankind, in the interest of patients. So doing this technological shift and maintaining civilization around people, social and scientific civilization together is a great challenge. And I think Italy can play a very important role in this because it does have very different characteristics. It is a strong producer of research, of pharma, and Italy has a great human attention, great research institutes where there is education and application. So the science, clinical science and innovation need real data, data that are acquired within these great institutions, which become more and more complex on the one hand, but at the same time, they must be delivered in the homes of people through telemedicine and all these new mechanisms in order to take care of people. This is an extraordinary challenge. It's a beautiful challenge, but the issues in terms of governance, administration, politics, organization, management is great too. So at the moment, we are very far in our capacity to manage this level of complexity. Not only us, but the whole world is far from managing this level of complexity. It is one of the highest, biggest challenge of governance of complex systems connected to the profound quality of welfare. So I think this is a European challenge indeed, and with our group, we are very, very committed to this, even in the framework of the G20. So this is not a solution for a prepared recipe. It comes from a joint effort where the private initiative, private investment, the capacity of thinking, of initiatives, both private and public, both individual and society, is very important. Closing ourselves in a state centralist vision, in my opinion, will produce two types of healthcare. One where citizens will go to have, something that is closer to their needs, and another public health care that is going to create a lot of risks if we think about the situation of the school now. So if we don't create more coherence, consistency within the healthcare systems, we will risk having countries that are going to age in their structures and in their capacity to face the future.